ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ। ਸ਼ਾਮਲ ਹੋ ਤੁਸੀਂ ਦ ਜਸਬੀਰ ਰੋਮਾਣਾ ਸ਼ੋਅ ਦੇ ਵਿੱਚ 3:10 ਇਸ ਵੇਲੇ ਸਟੂਡੀਓ ਦੇ ਘੜੀਆਂ ਤੇ ਹੋਏ ਨੇ। ਸਾਲ 2023 ਦੇ 6ਵੇਂ ਮਹੀਨੇ ਦੀ ਅੱਜ 8 ਤਰੀਕ ਹੋ ਗਈ ਹੈ ਤੇ ਵੀਰਵਾਰ ਦਾ ਦਿਨ ਹੈ। ਪ੍ਰੋਗਰਾਮ 'ਚ ਬਹੁਤ ਸਾਰੇ ਰੰਗ ਹੋਣਗੇ। ਮਹਿਮਾਨ ਸਟੂਡੀਓ 'ਚ ਆਏ ਹੋਏ ਨੇ, ਗੱਲਾਂ ਬਾਤਾਂ ਹੋਣਗੀਆਂ, ਕੁਝ ਗੰਭੀਰ ਮਾਮਲਿਆਂ ਬਾਰੇ ਤੇ ਕੁਝ ਰੌਚਕਤਾ ਹਮੇਸ਼ਾ ਵਾਂਗ ਪ੍ਰੋਗਰਾਮ 'ਚ ਸ਼ਾਮਲ ਕਰਾਂਗੇ। ਤੁਸੀਂ ਸ਼ਾਮਲ ਹੋਇਓ, ਆਪਣੇ ਖਿਆਲ, ਸਵਾਲ, ਟਿੱਪਣੀਆਂ ਲੈ ਕੇ ਪ੍ਰੋਗਰਾਮ ਦੀ ਲਾਈਵ ਡਿਸਕਸ਼ਨ ਦਾ ਹਿੱਸਾ ਬਣਦੇ ਹੋ 6042040600 ਤੇ ਫੋਨ ਕਰਕੇ। ਸਾਡੇ ਸਟੂਡੀਓ ਦੇ ਵਿੱਚ ਅੱਜ ਮਹਿਮਾਨ ਨੇ ਬਹੁਤ ਹੀ ਲੰਬਾ ਅਰਸਾ ਬਤੌਰ MLA ਤੇ ਬਹੁਤ ਸਾਰੇ ਮਹਿਕਮਿਆਂ ਦੇ ਮੰਤਰੀ ਵਜੋਂ BC ਲਿਬਰਲਜ਼ ਦੀ ਖਾਤਰ ਸੇਵਾ ਨਿਭਾ ਚੁੱਕੇ ਤੇ BC ਲਿਬਰਲ ਜਿਹੜੇ ਕਿ ਅੱਜ ਕੱਲ੍ਹ BC ਯੂਨਾਈਟਿਡ ਬਣ ਚੁੱਕੇ ਨੇ। BC ਯੂਨਾਈਟਿਡ ਦੇ ਆਗੂ ਲੀਡਰ ਕੈਵਨ ਫਾਲਕਨ ਸਾਹਿਬ ਸਟੂਡੀਓ 'ਚ ਪਹੁੰਚੇ ਹੋਏ ਨੇ ਤੇ ਅਸੀਂ ਉਹਨਾਂ ਨਾਲ ਸੂਬੇ ਨਾਲ ਸੰਬੰਧ ਰੱਖਦੀਆਂ ਬਹੁਤ ਸਾਰੀਆਂ ਗੱਲਾਂ ਬਾਤਾਂ ਕਰਾਂਗੇ, ਜਿਹਦੇ ਵਿੱਚ ਸਭ ਤੋਂ ਪ੍ਰਮੁੱਖਤਾ ਹੋਏਗੀ ਸਰੀ ਦਾ ਹੌਸਪੀਟਲ ਅਤੇ ਹਾਲ ਹੀ ਵਿੱਚ ਹੈਲਥ ਮਿਨਿਸਟਰ ਸਤਿਕਾਰਯੋਗ ਏਡਰੀਅਨ ਡਿਕਸ ਸਾਹਿਬ ਵੱਲੋਂ ਕੀਤਾ ਗਿਆ ਐਲਾਨ ਕਿ ਉਹ ਕੁਝ ਐਕਸਪੈਂਸ਼ਨ ਕਰਨ ਦਾ ਮੂਡ ਬਣਾਇਆ ਉਹਨਾਂ ਨੇ ਅਤੇ ਪਿਛਲੇ ਮਹੀਨਿਆਂ ਦੌਰਾਨ ਕੁਝ ਇਸ ਖੇਤਰ ਵਿੱਚ ਕੀਤੇ ਜਾਣ ਦਾ ਯਤਨ ਹੈਗਾ ਤੇ ਹੋਰ ਗੱਲਾਂ ਬਾਤਾਂ ਕਰਾਂਗੇ ਆਪਾਂ, ਜਿਹਦੇ ਵਿੱਚ ਕੁਝ ਕਰੰਟ ਤਾਜ਼ਾ ਮਾਮਲੇ ਵੀ ਸ਼ਾਮਲ ਹੋਣਗੇ। ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਬੁਲਾਉਣੇ ਫਤਿਹ ਕੈਵਨ ਫਾਲਕਨ ਸਾਹਿਬ ਨੂੰ। ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ, ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Great to see you, Dr. Romana, in person.
Thank you for being in the studio. And where should we start, actually? Let's start with the name itself.
Okay.
BC Liberals, they are BC United now.
Yes.
How is the experience so far?
I think it's been quite good, actually. I think it's important for your listeners to know one of the reasons why we agreed to change the name is we wanted to make sure that in this very multicultural, diverse province, we wanted people to feel really welcome in our party, regardless of where they were born or what religion background they come from or who they choose to love. I felt it was very important that we have a name that signify exactly the kind of party we want to be, united together, because united, regardless of background, is how we can work together for better solutions and outcomes. And I think the reception we've received has actually been very good. The biggest criticism that people came up with is the NDP said it sounded like a soccer team. And I actually really like that. And so we actually now have got soccer balls that are branded BC United. And we've been using them to raise money very successfully. I autograph them and we sell them at fundraisers. So
Should have brought one today.
I should. Actually, I'll bring you one. They really are very, very popular.
So what was the, make it kindly simplify the whole thing. What was the intention, basic intention? I know that you wanted to change the name. I know from the day one you were talking about it. But who wanted to, you wanted to bring them in?
Well,
which side? I mean, what kind of, voters you were targeting?
Yeah, mainly voters that aren't involved in politics. 95% of the public do not belong to any political party, okay? So most people don't go around and think, I'm NDP or I'm BC Liberal or I'm, Conservative or whatever. They just think about their families and their kids and the challenge of getting their kid into a school that's not filled with portables, or the challenge of going to a hospital and can't get, spending 15 hours in an emergency department. I mean, they think about those kind of things. And I wanted to make sure that we had a party that said, you know what? We want to appeal to everyone. We want to make it less feeling like a political party and more like a team, that we're all saying, hey, let's work together, because I think united and together we can get to better outcomes. It's really that simple.
Okay, let's talk about hospital, specifically City of Surrey.
Yes.
We had an announcement from our Honourable Minister 2 days back. And before that, doctors and frontline workers, they were writing open letters to highlight the problem. And I found out that you were in the hospital today.
Yes.
So let me know, first of all, your reaction about the announcements, about the quick fixes, and then in July they are planning to start the process of construction of that second hospital as well.
Sure. Well, that's what they say. But look, let's start at the beginning. So here's the big problem I have with the NDP government is they wait until something is a huge crisis. They first of all deny that there's even a problem. So Adrian Dix, as health minister, has been denying there's a problem at the Surrey Memorial Hospital. We've been raising this in the legislature for months. The community's been raising the concerns. Finally, the doctors, in great frustration, have done something I've never seen before, where they came out, and just unanimously, not from just the emergency department, but also from the obstetrics and pediatric departments, all the different parts of Surrey Memorial Hospital, all the physicians came out and said the system is failing and lives are being lost and lives are at risk. And that was, I've never seen that. And only when Adrian Dix found out that I was going to be touring through this hospital today did suddenly yesterday, the day before, they come and they make another announcement.
Really?
And yes, that's exactly what happened.
So you had a scheduled trip to the hospital?
Yes, we had a scheduled trip. They knew we were coming, and next thing you know, he swoops in and comes to the hospital and does his announcement. Now, here's the problem. This is what they always do. And, every time there's a problem, they go and they make an announcement. But I'll tell you, the frustration I have is this is a government of announcements, and we don't need more announcements or re-announcements. We need actual results. And the problem is we're not getting results in healthcare. So when I met today with the department heads of all the major departments at Surrey Memorial Hospital, what I heard both scared me to death, frankly, but also gave me hope. So on the scared me to death part is, one of the heads of the department, one of the most experienced physicians at that hospital said, Kevin, women coming to this hospital in Surrey, their lives are literally in danger. We have been juggling for so long, doing our very, very best, but we really feel like now that people's lives are in danger. And when they toured me around, they showed me why. There are entire hospital corridors filled with patients on beds. There's no privacy. There's no dignity. So the doctors were explaining to me how difficult it is for them to have to go and tell a patient in a hallway that your diagnosis is terminal cancer or your diagnosis is something very significant. And imagine it's traumatizing enough that you're in a hallway, but you have to get this in front of other people that are listening and other family members. It breaks my heart. I'll tell you that what gives me hope, though, is we have outstanding physicians and we have outstanding nurses at that hospital.
What was the reaction of those people you met today about the new announcement by the minister? Were they, saying that this is a good step in the right direction, or they were not at all happy about it?
Well, they're skeptical, okay? But I want to be clear. A couple of the things that Adrian Dix announced are good, and I want to be clear about that. I support it. So when he said, for example, that they would add a second interventionist radiology lab, that's a good thing. When they said that they're going to add 2 what they call cath labs, that's a good thing. But the problem is he said that won't be for at least 18 months. There's no money in the budget. This is something that he's just done because...
More details coming in 6 months.
Yes, exactly. More details coming. And the problem I have with that is, as I said to the doctors, when it's a crisis, you have to act like it's a crisis. It's not very good to say we're in a huge crisis. The doctors are writing all these letters. Don't worry, we'll have something a year and a half from now after the next election. That's not good enough. You got to move much, much faster than that. That's a lot of the feedback I heard. And there's a lot of skepticism because, of course, they've seen this problem developing for years at Surrey Memorial. And, Adrian Dix, when he was there yesterday, is talking about the growth in Surrey. And it's like, well, no kidding. You only figured this out in year 6 of your government and your second term, that there's been a lot of growth in Surrey and that we need to deal with these things. I wish they'd started 4 years ago. That would have put us in a way better place than we could have. Now, the other thing I have to tell you is that I announced something today, too, which I think is very important. I announced that a BC United government would start immediately on building a second tower at the current site at Surrey Memorial Hospital. Because when I did the $500 million expansion of that new tower at Surrey Memorial, we designed it to allow in the future to add a second tower right next to where the Dairy Queen is, where the current portables are. And that we have to get started on that immediately because that would allow for expansion for cardiac, for pediatrics, for obstetrics, et cetera.
That would have been my second question, but let's switch to the next one.
Sure.
Second hospital.
Yeah.
You kind of were criticizing from the day one. Why so?
Yes. Well, for a couple of reasons. And by the way, this is all the doctors said the same thing today. They're all very, very... they find it very hard to support this so-called hospital that the NDP are building. First of all, I don't call it a hospital. I call it a glorified urgent care center, okay? It's not a real full-service hospital that can deal with trauma and can deal with, it hasn't got a maternity ward, for example, in the fastest-growing community. And by the way, the maternity ward should be at the expanded tower that I'm talking about at Surrey Memorial Hospital. That would make the most sense, to be honest with you. But the problem is it's in a very difficult location. The biggest challenge we have today in healthcare is attracting staff. And the problem is where they want to put it is next to the trades campus on number 10 highway. And everyone in Surrey knows how busy number 10 highway can be. Imagine it's very poorly served by transit. It'd be very hard to get staff there. I've always said if we're going to build a second hospital, instead of doing a small one like they're talking about, let's do a 500-bed hospital on 176 and Fraser Highway where we're going to have rapid transit going right past there. And that means it'll be easier for us to get staff in that new hospital with sufficient beds, not just for today, but for the future. The problem is we're not building enough and thinking about the growth in Surrey.
That is altogether your idea, or you have many doctors and stakeholders they're also for this 176 location?
Oh, well, it's very much informed by what I hear from doctors, and it's very much informed by my own experience. I'll tell you honestly, when we did the $500 million expansion and built the $250 million Jimmy Pattison Outpatient Center the last time I was in government, I was thinking to myself, wow, this is fantastic because this will last, for at least 20 years for Surrey to deal with future growth. But Surrey has grown so exponentially, and the kind of clientele we have in Surrey is very different than Vancouver. The emergency department in Surrey deals with more children than Children's Hospital. It is the busiest emergency department in Canada.
If that's the case, I was talking to a few doctors, then why to criticize the second hospital, which is on that area, 176 and number 10? There can be a third hospital, actually. You can, if you become premier, plan that one, because this area is not only Surrey. This is Cloverdale and Langley and probably Aldergrove as well. And politically speaking, this is a seat-rich area, and this area will be instrumental to send you to Victoria as a premier.
Sure. No, of course. And when I'm critical, understand why I'm critical. I'm critical because they've been promising that second hospital for 6 years, okay? And, when I became leader a year ago, I was very critical because I said, NDP, you've been promising this for 6 years. You've never put money in the budget because any project over $50 million, you have to have money in the budget. Finally, they did it after the criticism. They added some money, some dollars, enough to do at least the planning and do the drawings, et cetera, and the design work. But when they talk about it starting in July, look, the best they're going to be able to do in July is push some dirt around and clear the site. But don't kid yourself. The construction's not going to be able to start in July because they just haven't done the work. But look, yes, go ahead. If they get started on this, of course I will support it and make sure it gets built. I will work with the doctors, though, and this is very important for you to understand. Every single department head at Surrey Memorial Hospital said, you know what the biggest problem is? None of them were consulted about the second hospital. And that's a problem when you're not talking to the frontline doctors about what kind of facilities they have at a second hospital. They're talking to the bureaucracy and the administrators instead of talking to the frontline workers.
I want you to comment on a rumor that I heard that this, change of location idea comes from a business lobby. They're pressurizing BC United. Well, I need your comment on that.
Well, it's a stupid comment. I've never heard that. That's the first time I've heard that rumor. But that sounds like the NDP trying to start a rumor. But look, here's why I say it should be at a different location. It's not because I was a former MLA from Cloverdale. I love Cloverdale. And it would still be in Cloverdale. It would just be on a location next to Fraser Highway because that's how you're going to get workers there. The biggest problem we have in hospitals is filling them. When I first got elected in 2001, there was a building that's now called the Jimmy Pattison Tower at Vancouver General Hospital that's the NDP built, but it was vacant for 10 years. Because they didn't have any workers to fill the building. I don't want that to happen again in Cloverdale. So you want to make sure you have it located where it's easy for workers to get to it. That's why I'm
the problem is very complicated. And we heard about a new medical school as well, which is kind of still in the talks.
Well, they keep promising it, but we haven't seen anything happen on that medical program. And at some point, I keep saying to the public, we have to understand with this government, forget their announcements. They're not important. We have to look at the results. Where is the medical program they promised at SFU that was supposed to be graduating people this year? It doesn't even exist. They've just started the discussions now, again, because we've been criticizing the fact that they haven't done anything. And that's all I'm saying. I'm just frustrated by the fact that they keep making promises and re-promising things without actually getting things built and done.
You can go for a sip of water and let me tell ਸਰੋਤਿਆਂ ਨੂੰ ਦੱਸ ਦਿਆਂ ਕਿ ਪ੍ਰੋਗਰਾਮ ਦਾ ਹਿੱਸਾ ਸਪਾਂਸਰ ਕੀਤਾ ਜਾ ਰਿਹਾ ਜੈਰੀ ਬਰਾੜ ਸਾਹਿਬ ਵੱਲੋਂ ਜਿਹੜੇ ਕਿ ਆਂਦੇ ਨੇ ਕਿ ਮੌਰਗੇਜ ਦਾ ਕੋਈ ਵੀ ਮਾਮਲਾ ਅੜ ਗਿਆ ਖੜ ਗਿਆ ਵਿਗੜ ਗਿਆ ਮਦਦ ਚਾਹੁੰਦੇ ਹੋ ਤੁਹਾਨੂੰ ਫੋਨ ਕਰੋ 604 762 8899 ਜਦੋਂ ਮਰਜ਼ੀ ਫੋਨ ਕਰੋ ਅਤੇ ਉਹਨਾਂ ਨਾਲ ਸਲਾਹ ਮਸ਼ਵਰਾ ਕਰ ਸਕਦੇ ਹੋ. I need a quick comment on the primary clinics that they had, and again a few doctors were telling me that there should be little bit more intermediate care rather than people going straight to the hospital, they should stay in those intermediate care places rather than these primary clinics. They are not doing anything. They're very basic.
Yes. Well, when we're at a point right now in British Columbia where 1 out of 5 British Columbians do not have access to a primary physician, a healthcare family doctor, that is a huge problem. That's almost 1 million people. But we also, Dr. Romana, have 1 million people on wait lists trying to see a specialist. And this is, the problem is this has been developing for years. Mm-hmm. Do you know only last year the NDP finally, after repeated pressure from us as an opposition, finally brought forward a health human resources strategy. They didn't even have a human resources plan to say, where are we going to get the new doctors we need to replace the retiring doctors and doctors that are leaving, and where are we getting the new nurses from? I mean, imagine waiting until your second term to do that. This is, I find this extraordinary. When I was first elected in 2001 as an MLA in Cloverdale, we had the same problem after 10 years of NDP. They actually did not add a single new doctor training space. We had to more than double the training spaces from 128 to 288 because it takes almost 10 years to train a physician. So it's this lack of planning that has got us into the position we're in today. Final thing I want to say is think about our cancer care. It used to be considered the best in North America. Under the NDP government, we're now sending 20% of our radiation patients south to the United States to get the private healthcare system in the U.S. looking after 20% of our cancer patients. The last time this happened in British Columbia's history was the last time the NDP were in power in the 1990s. It is mismanagement of our system that is getting us in this situation.
So it's the time for the news, but what if I ask you to tell me in 30 seconds, what will be the salient features of your plan to fix this problem?
We got to move quickly. We got to move aggressively and boldly. We would get a second tower built immediately underway, get the planning work started now so that we get a second tower at the current Surrey Memorial Hospital site. Then we would make sure that the second building, if the NDP have already started construction, we'll finish that job and make sure that the right care is there, probably much more emphasis on cancer care than all the others.
10 ਮਿੰਟ ਆਪਣੇ ਕੋਲੇ ਹੋਰ ਨੇ 10 ਮਿੰਟਾਂ 'ਚ ਇੱਕ ਦੋ ਸਵਾਲ ਮੈਂ ਕਰਦਾ ਤੁਹਾਨੂੰ ਬੇਨਤੀ ਹੈ ਕਿ ਕਿਰਪਾ ਕਰਕੇ ਅੰਗਰੇਜ਼ੀ ਬੋਲ ਕੇ ਸਮਾਂ ਬਚੇਗਾ ਆਪਣਾ ਅਗਰ ਤੁਸੀਂ 2 ਲਾਈਨਾਂ ਦਾ ਸਵਾਲ ਕਰ ਸਕੋਗੇ 2-3 ਕਾਲਸ ਮੈਂ ਲਵਾਂਗਾ ਇਹਨਾਂ ਦੇ ਜਾਣ ਤੋਂ ਪਹਿਲਾਂ but before that I want to ask a few questions and you can answer them briefly, Kevin. Okay. First one is about the portables in the schools. The other day when I was talking to Mr. Gary Thind, school trustee, and he was telling me that now they're planning to stack it and this problem is probably not at all fixable in near future. Need your comment on that.
Well, this is another example that I said at the outset that the NDP make big promises, but the results we get are just extremely the exact opposite of what they promised. So in this case, in 2017, the NDP government said that they were going to eliminate all the portables in Surrey in 4 years. Mm-hmm. What's the result? They've more than doubled the number of portables, and now it's so bad, and they're running out of room at many of the schools because they've taken up a big part of the parking lots, they've taken up part of the fields, and they're now looking at having to stack the portables to deal with the overcrowding. So, it's just another example of where they make these promises, and a lot of people believe them, unfortunately, and then the results we get are actually the exact opposite of what they promised.
Do you have any idea about the possible solution?
Yes. Well, first of all, what it requires is obviously building schools. Mm-hmm. But you have to know how to build the schools and get them done quickly. Just making the school announcement of funding is not enough. That's just the beginning. You actually have to make sure that the bureaucracy has a project team working with the city of Surrey like we did that said, okay, let's fast track these schools and get them done quickly. And that's where I think the NDP really struggle with is how to execute once they've made the promises. None of them come from a background in the private sector that has any experience in building things, so that they really struggle to actually get them done.
I remember off there I was asking about those refugees that come in city of Surrey and they are being sent under certain treaties that we have, international treaties and all that. But I'm pretty sure that there has to be some way collectively we can fight against the liberals that if they're sending those, we honor that. We can't say no to that, but right. We need money for that.
Yes, and this is one of the challenges they raised at the hospital, where they get a lot of refugees that come here from very difficult countries like Syria, Afghanistan, etc. and they have no understanding or experience of our healthcare system. And they frankly, the government's lucky in the sense that a lot of the people here, because they don't know how our system works very well, aren't even able to complain because they wouldn't know how to complain. But the fact of the matter is, we've got people that come, they present, they've got serious medical issues, they don't speak any English. It's very difficult to understand what their issues are. It makes for huge challenges. So what we need to do is work with the federal government and say, listen, of course we love refugees and immigrants, and we want to do our bit here in British Columbia, but you've got to make sure that the resources are here, that we're properly planning, that the infrastructure investments are being made in healthcare and transportation and all the other things that we're going to need in the school system to ensure that we can manage them.
Quickly about the open drug usage in the parks. That idea is being mooted nowadays, and this is going for every day. Somebody's mentioning that in my shows.
Oh, well, this is a huge problem. So when the NDP decided to decriminalize hard drugs like heroin and cocaine and methamphetamine and fentanyl, we said at the time, we cannot support this because there are no proper guardrails in place. And by guardrails, I mean you have to have a law that applies across the province that says we will not tolerate open drug use like heroin and cocaine, etc., in our parks, our playgrounds, and our beaches. And the NDP government has refused to do that. And I've pressured David Eby when I was asking him questions in the legislature, and he sort of said, well, we'll have a discussion with the municipalities. But they still have not done anything. And I cannot understand why, at the minimum, we would not say that we're going to protect our children from being exposed to open drug use in parks, playgrounds, and beaches.
Surrey police transition. I know it's a huge subject and we don't have time, but need quickly your position on that.
Well, this was right from the very beginning, we've suffered from a lack of provincial leadership. The province is hidden in the weeds on this thing, and then they waited until it's become the huge crisis it is today, and then they kind of made a recommendation, but then they went into hiding again, and now they're coming out again and saying, well, they want the government to go ahead with the Surrey Police Force, but then on the other hand, they're releasing a report that 80% of the pages are blacked out. They're trying to force the mayor and councillors to sign confidentiality agreements, which in itself I find very offensive. In my entire 12 years I was in government, not once did I ever have to ask a mayor to sign confidentiality agreements. There's an element of trust, and they swear an oath when they take office that they hold information confidential. So why they can't share more information with the public or even the opposition is beyond me, but it makes it really hard for me or the public or anybody to understand what is the right thing to do here, and that's frustrating.
Yeah, quickly, I was talking to people on this issue a lot, and taxpayers and residents of the city of Surrey, they're concerned about the law and order, they're concerned about the efficiency of the police and everything, but some people are saying that this is too much politics. Everybody's having political glasses on, and even provincial government or locals, they are fighting there. This is kind of push and pull. Nobody's concerned about the real issue.
I agree with you, and the fact is, it's also costing taxpayers $8 million a month. Every month that goes by without clarity around this. I think at this point, I think everyone's lost the plot. The fact of the matter is, we want to have the best possible policing in Surrey, and for God's sakes, let's get a decision done, get some more money into the system, because we need more resources for policing in Surrey. We can clearly see that. We've got crime exploding on every part of this community, not just in Surrey, frankly, but all throughout the province. But we need more resources to help the community be safe.
So it's already 3:45, and let me take 3 calls. Please, hor call na karyo. 3 calls, and very briefly, your question should be too big, too long. Raj, Sat Sri Akal ji, Raj. Raj, bolo ji.
Hello, Mr. Falcon. My question is, when somebody asks politicians, what are you doing to fix some problem, they always say, oh, we are spending this much money. But the real question is, where does all the money go? Like, for example, what happened in BC housing, right? So the money, they give them the money, but it's being taken up or whatever. They're using it for their personal benefits. How do we know that same things are not happening with the other government departments, corporations, Crown Corporation, and what would you do to fix this problem?
Great. Money spent should be seen somewhere. And Mr. Patti, you can ask Punjabi or English, whatever.
Hi, guys. Good afternoon.
Hello.
My question is, when a Liberal was in power 10 years, we had the same issue. So why didn't you build a second hospital in Surrey there, and you sold the land? Now you're saying that there's a portable. You're the guys who's closed the school and hospitals before. Now you're claiming that the NDP is not doing anything. So
Great.
first answer: why did you sell those properties?
Great. So we have two questions now. First one was the money spent should be seen, and the other one.
Sure. So Raj is absolutely right about money spending. And so let's use an example. When we see wasted dollars, like, for example, when they canceled the Massey Bridge, the 10-lane Massey Bridge that had already been started by the previous BC Liberal government. I wasn't in government at the time, but it was the right decision, a 10-lane bridge that would have been open last summer, by the way. And because they canceled it after $100 million had already been spent, and they had a fixed price contract in place for $2.6 billion. And that is unfortunate waste of money. But you also see it in the way that they're building things, and they don't know how to build things properly. So, for example, the Cowichan Hospital that started out with a $600 million budget, because the NDP said we're going to build it using what I call community rip-off agreements, which forces the anyone bidding to say they have to use these certain designated NDP unions to build them. That budget has gone from $600 million to $1.4 billion already, and it's still not completed. So that kind of wasted spending, we just cannot afford.
But the
to do.
rationale is that the money stays local. Local people benefit from this.
Well, local people always benefit when you're building infrastructure here. All the workers, everyone comes from here. All the machinery, equipment, etc. So it's not a good.
So the second one.
Yeah, so the second one is that this is a fiction that the NDP keep trying to spread. So they keep saying, I somehow personally sold the lands down at 152nd and number 10 Highway for a proposed second hospital. Not true. What happened was the health authority said those are lands surplus to our needs. In other words, we don't need those lands because even if we wanted to, we wouldn't build a second hospital there. Why? Because it was too close to the initial hospital and also didn't have good transit. So they made the decision to sell those lands. Now, here's the problem. So what the NDP did is they've now chosen that hospital in Cloverdale that, as I say, is behind the Trades and Technology campus and will be very hard to access for people and emergency vehicles and workers, etc.
I think we are done talking. You have to go somewhere. I know that. So how would you conclude the whole thing, and any conclusion and the last message for our audience?
Well, my last message for the audience would simply be this. Look, when I was in government, we weren't perfect too. One of your callers said we closed schools. We didn't close any schools in Surrey, I can assure you. We just built lots of schools. But the point is, we're not perfect when we're in government. But we got the big things right. We got our balanced budgets. We got our AAA credit rating. We hosted a great Winter Olympics in 2010. And we invested more in infrastructure than in any other 10-year period that I can recall in the history of this province, with lots of projects, especially in Surrey. Not just the $500 million expansion of the hospital and the $250 million Jimmy Pattison outpatient, but the widening in number 10 and 176th Street and the Portman Bridge, South Fraser Perimeter Road. Lots of big, important investments. And so what I want the public to know is this. Don't judge government by what we promise. That's not good enough. Judge by the results we're getting. And the results we're getting right now in healthcare, in crime, in housing prices are the worst we've ever seen. And that's not good enough.
Thank you for being in the studio, and next time come for 2 hours.
I would love to. Thank you very much, Dr. Romana.
Thank you, sir. Thank you for being in the studio.
Okay.